Some topics feel so familiar that we think we know the whole story. But when it comes to HIV and AIDS, the reality has just changed so dramatically over the last few decades. It's an incredible story of loss, but also of scientific revolution. What was once a death sentence, well, it's been completely transformed.
To really get how far we've come, we have to start with this number. Since the pandemic was first recognized, HIV has taken an estimated 44.1 million lives around the world. That's just a staggering number. It represents a truly world-altering crisis, and it's a major public health issue to this day.
But, and this is the whole reason we're doing this explainer, here's the crucial point. For people who can get modern medicine, an HIV diagnosis is no longer a terminal one. It's now a manageable, chronic condition. So the big question is, how on earth did we get from that devastating number to this point of hope? Let's break it down.
Okay, first things first. To really appreciate the progress, we've got to understand the virus itself. And that means starting with how it gets from person to person, and just as importantly, how it doesn't.
So, what is HIV exactly? Well, it's a virus that goes right after the heart of your body's defense system. It targets these specific white blood cells called CD4 cells. You can think of them as the generals of your immune army. And by taking out these generals, HIV leaves your body wide open to all kinds of other infections and diseases. Now, the virus can only be transmitted through a few specific body fluids. We're talking about blood, semen, rectal and vaginal fluids, and breast milk. This is why transmission happens through things like unprotected sex or sharing needles, or sometimes from a mother to her child during pregnancy or birth. And this part is just as important, because this is how we fight stigma and fear. You absolutely cannot get HIV from normal, everyday contact. It's not spread by kissing, hugging, shaking hands, or sharing food. The virus just can't survive outside the body long enough for any of that to happen. All right, so what happens when the virus actually gets inside the body? Let's follow its path and see how it wages war on the immune system.
The virus has this brilliant but totally destructive strategy. See, HIV attaches to one of those CD4 cells, fuses with it, and then injects its own genetic material inside. But it's RNA, not DNA. So it uses this special enzyme to rewrite its RNA into DNA. And then it literally stitches that viral DNA into the host cell's own DNA. That cell is now hijacked, and its new job is to pump out thousands of new copies of HIV, which then burst out and go infect even more cells.
Now, if you leave it untreated, the infection moves through three pretty distinct stages. It kicks off with an acute phase, then it settles into a long chronic phase, and eventually it can lead to the final stage, AIDS.
So in those first few weeks, the acute stage, the virus is just multiplying like crazy. Some people might get flu-like symptoms, a fever, a rash, but a lot of people won't feel sick at all. And because the symptoms are so general, it's really easy to not even know you've been infected.
After that, the infection moves into the chronic stage. Now, this is the tricky part, because this can last for many, many years. A person might feel totally healthy, but behind the scenes, the virus is still active, slowly and steadily destroying more and more of those crucial CD4 cells. And if it's not treated, the immune system eventually gets so damaged that it can't protect you anymore. This leads to what we call opportunistic infections. These are illnesses that a healthy immune system would normally fight off without a problem. This picture, for example, shows Kaposi sarcoma, a cancer that became one of the tragic symbols of the early AIDS crisis.
So let's be really clear here. AIDS isn't a separate virus. It is the final, most severe stage of an HIV infection. You're diagnosed with AIDS when your CD4 cell count drops below a critical number, 200, or when you develop one of those specific AIDS-defining illnesses.
For years, that progression was pretty much inevitable. But then everything changed. Science fought back, and it's truly one of the greatest success stories in all of modern medicine, the ART revolution.
ART stands for antiretroviral therapy. It's basically a combination of medicines that attack the virus at different points in that life cycle we just saw. Now, it doesn't cure HIV, but it does an amazing job of stopping the virus from making copies of itself, and that gives the immune system the breathing room it needs to recover and rebuild.
So, when someone takes these medications every day, what's the ultimate goal? It's not just about feeling better. It's about hitting a very specific, measurable target inside the body.
And that goal is to lower the amount of HIV in the blood, what we call the viral load, so low that a standard lab test can't even find it anymore. That's what it means to have an undetectable viral load.
And this leads us to maybe the single most life-changing public health message of the last 20 years. Undetectable equals untransmittable, or U equals U.
And let me be clear, this isn't just a catchy phrase. This is a scientific fact, backed by massive studies and confirmed by every major global health organization. A person with HIV who takes their treatment and stays undetectable cannot pass the virus to a sexual partner. It's an absolute game changer for prevention and for ending stigma.
So, with this discovery and other powerful prevention tools, we now have a clear roadmap. We can not only manage the HIV epidemic, we can actually end it.
On top of using treatment as prevention, we have other amazing tools. You've probably heard of PrEP. That's a medication that people who are HIV negative can take, and it drastically reduces their risk of getting the virus in the first place. And this all feeds into a clear global strategy, summed up by these numbers: 95, 95, 95. The goal is to get 95% of people with HIV to know their status, get 95% of them on treatment, and get 95% of them to an undetectable viral load. If we hit these targets, we can truly break the chain of transmission.
So when you step back and look at it, we've gone from a mysterious fatal disease to a totally manageable chronic condition. We have the science, we have the tools for both treatment and prevention. The only question left is for us. With all of this in our hands, can we be the generation that finally ends the AIDS epidemic?